To Washington, D.C., Juan Carlos Hidalgo is with the Cato Institute, a public policy research organization. Let's pick it up from that idea that some countries are articulating, at least, that some drugs should be legalized. The U.S. says no, because it would make drugs more readily available. What would make the problem less acute in Latin America, where it is at its most serious?
Indeed, the report denounces what it calls imperialism of drug control imposed by the U.S. in particular on other countries, especially in Latin America, where the prohibitionist approach has prevailed, and that has led to a lot of problems in the region. We see Mexico, for example, where drug violence is costing the lives of 35,000 people so far since President Felipe Calderon came to power and announced a war on drug cartels. But we also see it in Central America, where these Mexican drug cartels are growing in power and influence. We see it in the Andean region, in how drug production has fueled terrorist groups like the FARC guerrilla in Colombia or the Shining Path in Peru. So I think that Latin American countries stand to benefit a lot from a different approach to drug policy like the one recommended by this committee.
Has that military approach that has been so encouraged, some would say even forced upon some of these countries like Colombia, like Mexico, by the U.S. administration, has it completely backfired? Has it only created more drugs and more violence?
There is a wealth of evidence, and is reviewed by the report of the Commission on Global Drug Policy, that shows that escalation in the war of drugs leads to more violence. We see it in Mexico. The states where President Felipe Calderon has deployed the army have witnessed a dramatic rise in crime and violence and homicides as a result of bigger and more deadly encounters between the drug cartels and the army and among drug organizations. So obviously more of the same, more violence, more tightening of drug policy is not working in solving the problem of drug violence.
And do you think Latin America's drug problem can be solved as long as the U.S. continues to fuel the demand for drugs across the borders of some of these countries?
As long as the U.S. continues to endorse the prohibition policy that is now common around the world and the prohibition of drugs, we're going to see more of the same problems. The problem is not consumption per se, but the prohibition. Prohibition is what creates a black market, and this black market is conducted by criminal networks that rely on violence and corruption to get their business done. So if we want to see drug violence eradicated, we have to legalize drugs. That's one of the recommendations of this report.
Does it help, do you think, to frame the issue as a war on drugs instead of looking at it as a social health problem? The U.S., and we've been speaking to some U.S. officials, have been telling us that they think this report has been grossly mischaracterizing their approach, that they do not take the mentality of a war on drugs approach, that they take, quote, the approach of a treatment/education perspective to this. Do you agree with that?
No, not at all. Every year, more than 1 million people get arrested in the United States for consumption of drugs. That's not how you treat the people who are sick. That's how you treat criminals. And we see it in the United States. It's the country that has the most people in prison everywhere in the world, even more than totalitarian regimes like China. So definitely the approach in the United States has been an approach that has relied on enforcement, has relied on tough measures, it has relied on using the police and armed forces against the people who consume drugs. And that's why we see that many of these problems in other countries too, that have followed the leadership of the United States in drug policy, and they're paying even more dear consequences.
But how do you assess the way the U.S. administration has been approaching this issue, not just under the previous administration, but under Barack Obama? If I can just quote from what Laura Carlson has recently written. She's the director of the Americas program at the Center for International Policy. She says, the drug war has become the major vehicle of militarization in Latin America. It's a vehicle funded and driven by the U.S. government and fueled by a combination of false morals, hypocrisy, and a lot of cold, hard fear. The so-called war on drugs is really a war on people, especially youth, women, indigenous peoples, and dissidents.
I agree. The new drug czar appointed by President Obama said that he didn't like the term war on drugs. But if you look at the way that the Obama administration has been spending money on drug efforts, it's basically the same as previous administrations, relying heavily on drug enforcement and the use of police and military aid to other countries. And there is a lot of hypocrisy in this policy. As well as I mentioned before, you see that the people in Latin America, especially Mexico and Central America, are dying because of drug policy, whereas here in the United States we have the former Olympic champion Michael Phelps being caught smoking marijuana and nothing happens to him. Even President Obama has admitted himself that he consumed drugs when he was young. So why is it that Latin Americans continue to put the deaths and the violence and the blood to prevent Americans from consuming drugs that they want?